Hello, my name is Dr. David Hartz, and I want to welcome you to this seminar and workshop on chronic digestive disease and stomach pain. Now, this particular condition is so prevalent throughout the population of America and actually throughout the world, and it's causing tremendous amounts of trouble, and people are taking medications for this at an increased rate, and they're getting results which are not what they're looking for, and people are looking for alternatives for all chronic diseases to avoid taking the medications that are being prescribed. There are so many different side effects for these medications as we're going to cover, and the sad part about it is they're not even getting to the underlying cause of disease. And what we do with alternative healthcare and clinical nutrition, which I'm so excited about because I've just seen thousands of people benefit from this, is giving people natural alternatives with things that just have no side effects. And one of the cool things is that we're pushing down and getting underlying causes of the diseases better. So what are we going to cover? We're going to talk about reflux esophagitis, irritable bowel syndrome, diverticulitis, ulcerative gastric ulcers, and also ulcerative colitis as we go along, gastric emptying dysfunction, inflammatory bowel disease, the gut-brain connection, autoimmune disease, and what we can do about all this stuff naturally. What are some natural alternatives to these different conditions? And is there underlying causes to all these different syndromes that we've applied names to that we can find commonalities to go after? And that's what we're going to be talking about. Now, what is the dimensions of this thing? There's just millions and millions of people suffering from chronic irritable bowel syndrome, chronic digestive disease problems. And according to the National Institutes of Diabetes and Kidney Disease, 60 million people experience heartburn at least once a month, and 25 million experience symptoms daily. And we're going to see that these numbers are increasing and have increased. Gastroesophageal reflux disease, we call it GERD, a more serious form of acid reflux, is the most common digestive disease in the United States. Extremely common. The studies show that 10 to 20% of individuals experience symptoms at least once a week, and the prevalence of GERD is increasing steadily. This is something that is not under control. When you don't get the underlying causes of disease, they continue to escalate and get worse. And if you just cover over them with symptoms, a chemical, a pharmacology that just merely controls their symptoms, the underlying fire just keeps burning. And if not taken care of, it can burn down the house. And that's what we're trying to go after with trying an alternative integrative approach. Is it big business? You better believe it. Drugs for acid reflux and GERD are cash cows for pharmaceutical companies. I mean, they're making them unbelievable amounts of money. And some of these, these are old statistics. The $60 million in prescriptions for GERD were filled in 2004. It's increased, now look at this, to 113 million by 2019. I mean, it's increasing exponentially. You think that many more people are just being diagnosed with GERD? No, it's the underlying conditions increasing, and that's what's happening with all these chronic diseases. Our system of medicine is not addressing the underlying causes. We're patching them with chemical patches, and the underlying causes are getting worse and worse and worse. And that's really my passion, is trying to figure out what the heck is getting people sick at the root level. I mean, and when we get to that, these conditions can be managed very nicely without all these medications. Now, sometimes we need medication. I'm not saying we always can do it without it, but I tell you what, it's amazing how much we can do without. Americans spent $13 billion on acid-stopping medications in 2006. That's in six, and it's gone up twice, multiple times that now. Nexamen, and most popular bought at $6 million alone, $6 billion, making it the second highest selling drug behind Lipitor. I mean, these are the highest selling and most lucrative drugs in all of pharmacology. GERD, they estimate right now, is costing employers and the society in general $75 billion a year. Reflux esophagitis, let's just talk about that. Now, what is this? See, we have the stomach, and we have the fundus of the stomach, and we have the esophagus that enters the stomach at this place. And what happens is the contents of the stomach gets refluxed up into the duodenum, okay? Duodenum's down here, into the esophagus. And the esophagus itself is not made and not really engineered to handle acid. The stomach down here can take into the ones and twos of the pH, very low pH, very acidic. But when it gets refluxed into the esophagus itself, the esophagus can't handle that kind of pH, and then we get irritation and burning. The problem, as we're going to see, is this valve right here, lower esophageal sphincter, we call it, LES. And this is the problem. It's not so much that the stomach has too much acid in it. This is going to be really important as we talk about. But what GERD is, it's a burning of the esophagus because of the reflux, the retrograde kind of flow of acid not staying in the stomach, but being allowed to go through and back up into the esophagus itself. In recent editorial publishing in the Journal of Gastroenterology, the author remarked that we're not getting to the cause of the problem. Gastroesophageal reflux with profound acid inhibition will never be ideal because acid secretion is not the primary defect. I mean, research has come out in gastrointestinal journals saying we're not doing the right thing. We're actually suppressing acid production when the problem is there's actually too little acid. Now we're going to talk about this because this seems so dynamically different than what everybody is saying, and the whole thrust of esophageal reflux treatment pharmacologically is to decrease acid secretion in the stomach. And we're going to show you why that doesn't make a whole lot of sense. Now, numerous studies have shown that the stomach acid secretions decline with age. And it's interesting, too, that the prevalence of acid reflux increases as you get older. Now, if this was acid that was a problem, why wouldn't it get better as you got older? Because your acid decretion actually decreases. In fact, women in studies found that over the age 80 produce almost no stomach acid at all. They've gotten down to a place at 80 years old where you don't have any stomach acid any longer. So 40% of the women over the age of 80 do not have any stomach acid at all. So it doesn't make any sense that the fact that we're having too much acid is the problem, because we actually get worse as our acid gets less. Now, so here's a graph that kind of shows that. It shows that how our acid consistently decreases as our years increase, which obviously doesn't make sense if it's the other situation. Now we do know that acid decreasing increases bloating and gas in the stomach. And stomach HCl, hydrochloric acid, supports digestion and absorption of carbohydrates by stimulating the release of pancreatic enzymes into the small intestine. If the pH of the stomach is too high due to insufficient stomach acid, the pancreatic acid will not be secreted and carbohydrates will not be broken down. So what this is saying is that not only does the hydrochloric acid, which is not secreted at sufficient levels, and many people, by the way, this doesn't always happen at people that as they get older. This stomach acid can decrease very early in age in certain situations. We see, it happening with all kinds of things, with B12 deficiencies and other problems in very young ages. So this is not an old age disease. This is something that happens in younger age. But the ramifications is not just in the stomach, and that's what this is saying. As this hydrochloric acid is secreted in the stomach itself, it triggers off pancreatic enzymes that are stimulated to be excreted, that break down carbohydrates, breaks down other factors that and other long chain and short chain fatty acids into the small intestine. So the hydrochloric acid in the stomach breaks down protein. That's a loss, but when it's decreased, it also doesn't stimulate other enzymes in the pancreas to be released, and then you have a whole cascade of enzyme deficiencies which affects your whole entire digestive system. And so the pancreatic enzymes will not be secreted and carbohydrates will not be broken down properly. This produces pressure and backflow into the esophagus. So when carbohydrates aren't broken down correctly, then it produces increased areas of pressure in the stomach of gas and bloating. And those particular pressure actually causes a retrograde flow, which pushes the acid that is existing back up into the esophagus. It's well accepted in the literature that GERD is caused by increased intra-abdominal pressure. The acid reflux occurs when pressure causes gastric distension, the stomach bloating, that pushes the stomach contents, including the acid, through the LES, the lower esophageal sphincter, into the esophagus. And what this looks like is this. So we have gas here that bloats up into the stomach, and then the retrograde flow pushes this acid up into the esophagus, which once again is not designed to handle low pH. The stomach can handle it down here, the esophagus cannot. And so the lower stomach acid, you can get bacterial overgrowth because of that. The stomach acid itself, by the way, is a tremendous antibacterial effect, that when you eat things that have abnormal bacteria and so forth, that the low acid in the stomach, actually low pH, kills this bacteria so that it cannot continue down into your stomach, into your small intestine, large intestine. And so therefore it's a protective mechanism. So you get bacterial overgrowth in the stomach and small intestine. Of course, the stomach is hard for the bacteria to grow there because the pH is so low, but when the pH starts increasing, we can end up getting H. pylori and a couple other ones we're going to be talking about in a second, bacterial overgrowth that can occur. Of course, then we get the maldigestion of the carbohydrates and the bloating, and then it leads to heartburn and GERD eventually here. It's a cascade of problems. So the microbial overgrowth that can occur is bacteria, fungus, and parasites can occur because of the increasing pH in the stomach and the loss of that barrier of that lower pH. Let's talk about some causes of this malfunction of this lower esophageal sphincter, because when you really get down to it, that sphincter being tight around the bottom of your esophagus is what keeps the acid out of your esophagus. And what their pharmaceutical answer to this is they just, whatever little bit of acid you have left in your stomach, in some cases a fairly good amount, but it's just because the LES is relaxed. If you decrease that acid, then if it regurgitates back up into your esophagus, it just doesn't burn because there's no acid in there. Well, the problem with that is we have no acid now to digest protein. We have no acid to stimulate the pancreatic enzymes to break down the carbohydrates, and the whole cascade starts. And so if we can figure out what affects this LES, and I've seen this happen, I've treated just thousands of people with this, where once we get the LES functioning, the acid stays in the stomach and their symptoms go away. And then it can function the way it's supposed to instead of just taking all the acid out of their stomach and then we're having all these cascade of all these other problems which occur. And so some of the things that can affect this and contribute to it is certain foods, hot pepper, citrus, tomatoes, drinks, caffeinated alcohol, overeating, overweight. The more abdominal adipose you have in your stomach and in your abdomen, it can push up on the stomach and actually cause some hiatal hernias, where you herniate the top part of your stomach up through your diaphragm, opens up that and actually increases the LES and the esophageal sphincter becomes more open. Many medications can do this. People don't realize that NSAIDs, the Advil, Nuprin, Motrin, all those antibiotics can do it. Bronchodilators, beta blockers for high blood pressure can do it. Calcium channel blockers for high blood pressure, nitrates in food, antidepressants, anti-anxiety, anticholinergics are all associated with weakening the LES. They can do it, and once they start doing that, all of a sudden then you get symptoms, and then you're off on what we call proton pump inhibitors, PPIs, which is what they give you for inhibiting the acid in your stomach. Recommendations for GERD: reduce or eliminate sugar, starchy carbohydrates, processed foods, alcohol, and coffees. Eat slow, chew food well, limit liquids at mealtime, drink 8 to 12 ounces of, avoid drinking too much so you don't dilute the gastric juices at mealtime. You want to kind of keep you should drink certain good amounts of water and stay hydrated, but just not around your meal. so that your gastric juices can actually digest your food. And avoid combining starches, sugars with proteins. It does seem to have more of a problem when you put a lot of sugar, like eat a big steak and then have a bunch of ice cream on top of it, or a dessert. That does cause more bloating. And supplement with betaine hydrochloride, pepsin, and pancreatin. You can actually replace some of this betaine hydrochloride. The good news is sometimes, especially if you're younger, you take the betaine hydrochloride, it'll stimulate more acid production. After a while, the body may be able to do it on its own. But taking those supplements are really easy, and they're very safe when done correctly. Now let's talk about irritable bowel syndrome. We got a lot of syndromes to go through here, and we want to touch on all of these. Unfortunately, I can do a seminar on each and every one of these, but I'm trying to touch on all of these, at least some. Irritable bowel syndrome is really a major problem too. There's so many people with this. I've had a long history of this my entire life. I know a lot about it. And if I wouldn't have had alternative healthcare helping me, I probably wouldn't be alive at this point from this. And so I know it helps. It's abdominal pain and cramping and bloating feeling, gas in the stomach, diarrhea, alternating many times, diarrhea with constipation, sometimes stuck in one or the other. Mucus in the stool, and chronic abdominal pain. And this is so familiar and so common. I have treated so many people with this. And it can be affected by so many different things. And this is the key that we find in what we do. IBS, the single one symptom, can be affected by environmental factors like bacteria, parasite, and yeast. We call it a dysbiosis in the gut, where the normal bugs in your belly and in your small intestine, large intestine that's supposed to be there become imbalanced, and you get some bad ones. You get bad bugs instead of good bugs. The barrier integrity of the gut itself, which is a lining, gets broken down, and we call that leaky gut syndrome, and that affects all kinds of things, including autoimmune disease. And digestive enzymes become deficient. You have developed food sensitivities like dairy and gluten, and these can be a distinct problem. And once these get going, sometimes you have to eliminate those sensitivities to get some healing in the gut. And of course, the autoimmune conditions I mentioned with the leaky gut syndrome, they start affecting the gut itself and then throughout the entire body. Almost 70% of all chronic disease is autoimmune related, and most of it's coming from the gut. This is why this is not just a gut problem, it's a body problem. And it can also affect hormones and then inflammation, which once again is 80-90% of what's causing chronic disease in people today. So this irritable bowel thing is huge, and most people that have chronic disease have some problem with this. And if they don't, I go poke it on their stomach and they hurt, and they don't even know they're hurting because it's just down below their pain threshold. Diverticulitis, once again, it's an inflammation of individual little pocketings. It starts to cause a little out-pocketing because of usually chronic constipation, where your body has to really strain, and there's a lot of extra peristaltic contraction of the bowel, and it causes little out-pocketings in the bowel eventually. And they can produce an area for bacteria to get into, and then we can get eventually rupture, which causes major problems. But this diverticulum can cause problems, and sometimes they're treated with antibiotics, sometimes you get rupturing, and sometimes they have to go in and take out part of your bowel if this occurs over a long period of time. So this is really important to get early whenever you can get it. So the causes of diverticulitis have normal transient times for food that passes through your colon. When you eat something, theoretically we like to be seeing it going out within 24 hours. People, listen, I had an employee that worked for me one time. She came in, and I found out after I hired her, she was having a bowel movement once a month. Now, if you can believe that, it was just unbelievable. Some people go 2-3 days. That's not normal. You're supposed to be, moving things through your bowel at a normal transient time. Certainly no more than, 36 hours. Certainly no more than 48 hours. But people do, and as the body has to work harder to move the fecal material through, then we end up with these problems. Abnormal balance of the natural biome of the gut is another. And once we get the gut biome off, then we start to get more spasm. And then with irritable bowel, instead of having a normal peristaltic wave, we end up getting normal peristaltic wave just gets certain nice rhythmic contractions where things move through your bowel. When you end up having irritable bowel syndrome, all of a sudden now we get spasm of the entire bowel. So instead of a nice peristaltic wave, we have just a spasm, and it doesn't cause motion of the fecal materia, it just causes constipation. Now, next one we want to talk about. So, we're going to be talking about way to help each and every one of those in just a second. But let me go through a couple more syndromes. The next one is gastric ulcer, and what happens with this is that we get increased acid, and there are a few cases, just a few cases, a small percentage, where you actually end up getting ulcers from increased acid, and it's actually truly increased acid, but that's very small and far between. Most of their GERD and so forth is all caused by decreased acid, but there's a small case where we do get little lesions in the stomach and course up into the esophagus from the reflux. We can get them up there without a whole lot of acid in the stomach, because this is just not prepared and developed and designed to handle low pHs. This one is, and when there is, it can cause problems. And the most common places is down here in the duodenum. It's past this little another sphincter that separates the duodenum from the stomach, and we start to get duodenal ulcers there. What can happen is we get H. pylori, which many times can be from a decreased acid in here, but the H. pylori gets in and actually starts causing an infection, like a little infection in the stomach itself. And it's a certain bacteria called Helicobacter pylori, and it causes a lesion in the stomach, and you actually can handle this many times naturally. Sometimes it does take medications and antibiotics to handle this, but it can be handled many times naturally, and it does produce a specific type of gas outcropping, which can be measured, but we also have ways energetically to do this, where we can actually non-invasively figure this out. But the H. pylori is divergent mucosal secretory response of H. pylori infection, and it can affect increased gastrin, which is an enzyme within the stomach, which produces the ulcer itself. The corpus predominant multifocal atrophic gastritis, which is decreased acid and increased gastrin. Many times it can be increased acid and increased gastrin, which has little or no atrophy, low risk for gastric carcinoma. If you get this one where you get low acid, increased gastrin, it's a high risk of gastric carcinoma. And so these need to be evaluated and treated, but there's usually a mixture of these two. And the key to this is getting this stuff early and having normal acid secretion in your stomach and not allowing this to develop to start out with. Self-help for gastric ulcer, decreased carbohydrates. Once again, you'll see that consistently in all protocols for just increased body health. And decreased sources of stress. Stress does cause problems. Use an apple cider vinegar challenge and use vinegar or HCl accordingly. If apple cider vinegar challenge causes burning in your stomach, when you take say a little bit of apple cider vinegar, just like maybe a little small shot glass full or a couple shot glasses full, and then you have a dressing that has apple cider vinegar in it, and you end up getting burning in your stomach when you do that, there's a good chance that you have too much hydrochloric acid or you have a gastric inflammation that you need to be able to take something that decreases acid secretion. Most of it's amazing is that when people have gastric reflux and they use this apple cider vinegar challenge, they feel better. They'll say, when I eat vinegar or something, I feel better. That means that you have too little acid. And by taking a supplementation of betaine hydrochloride, that will help it. So you can use the little acid vinegar challenge to see which is best for you. Gastric emptying dysfunction, you can have a transit times of how long it takes for your stomach to. I had a patient who had a transit time problem in her bowel. Everything she ate took about 18 hours to get it out of her stomach, and she had been everywhere. She'd gone to everywhere, Mayo Clinic, everywhere, and we helped her. She got back to totally normal transit times, living normal life. And so it can be not only that it's not producing the right types of gastric secretion, it can be that your body doesn't move the food through at normal transit times, And these different factors, including some of the things we're going to talk about in a second, can affect that. And it can be delayed for hours and hours and hours, so that the stomach contents just never get moved. So let's talk about inflammatory bowel disease real quick. IBD, this is Crohn's disease and ulcerative colitis. These get serious, and sometimes I do need medical intervention, especially if they've caught down the road. And where I like to get these is get them as early as you possibly can if we can find the causative agents. And many times this, of course, is an autoimmune disease, and you got to drill down to find out what is producing the increased cascade of the cytokine production in the bowel that's causing this inflammation, and getting to that. The most common signs of Crohn's disease: diarrhea, abdominal cramping, pain, loss of weight, feeling tired, nausea. Anemia can happen because you start losing blood. Signs and symptoms: inflammation outside intestines, including joints, pain, soreness, skin irritations. Sometimes you can get inflammation that affects eyes as well as joints, as well as changes in the skin. And it can be quite debilitating and very serious when left unchecked. Symptoms of ulcerative colitis may include blood or pus and diarrhea, dehydration, abdominal pain, fever. Painful, urgent bowel movements. Okay, when you start getting pain and mucus and blood, then we've got this inflammatory bowel disease going on then. And the idea is to try to get this before. Now, we treated lots of people with this. You can help it. You got to get it before there's a lot of bowel damage, and you got to get to the underlying cause. So the key is this: the biome of your gut, the bugs, are absolutely critical. And the scary part is there are more of them, these bacteria and virus and fungus and parasites in our guts than us. All right, I mean, there's more cells, there are more bacteria, there are more microbes, let me put it that way, than there are cells in our body. So there's more of them than us. And the leaky gut we mentioned earlier is when these protein and different substances that's supposed to be within your bowel end up going through the villi, and they're supposed to be these little links together that control what goes through in the bowel wall itself, and they start to break down, and before you know it, they're going through the bowel and getting in the bloodstream, and the body is never meant to have these large particles and molecules getting through into the bloodstream. And when it does, it stimulates the immune system to send off all kinds of cytokine reactions. And when that happens, then we end up producing autoimmune reactions, inflammation, malabsorption, blood-brain barrier breaches. This happens the same way in the blood-brain barrier between the blood and the brain, and we end up with Alzheimer's, dementia. We end up with mood disorders, manic depression. All kinds of things can happen, and these junctions, these tight junctions in between these cells, get broken, and it allows things to get straight in. So this can affect so many different things in our body. Pain in the gut is certainly debilitating, but it's only the small little thing, small part of the iceberg above the water. The rest is below the water, and it's a lot more serious. So here we go again, showing how these large particles are getting through, and then there's an autoimmune attack that occurs to these cells, and we get the autoimmune reactions. So the gut-brain connection, we know there's a problem here. We have a relationship between the brain, the autonomic nervous system, made up of two parts, the parasympathetic and sympathetic. And this is important because the LES can be controlled by the nervous system. It's a part of the neurological system. And when these imbalances occur, it affects your entire body. There is a healthy brain runs your body, and I don't want to get too complicated with this, but there's a mesencephalic reticular formation, which is the fight and flight mechanism of your body, and the pontomedullary reticular formation, which is the control and heal part. And there's supposed to be a balance between these two. And as we go along, especially as we get older, parts of the system decreases and other parts increase, and we end up having kind of more of a dominance of a sympathetic effect in our body. The parasympathetic heals and regenerates, causes normal peristalsis in the bowel, moves food through us. Sympathetic is fight and flight. Is for when you get under attack, and so your body doesn't need to digest at that point. It needs to move and increases heart rate, increases blood pressure. And so as we get older, certain parts of our brain start to kind of have certain amounts of aging which occurs to it, so we become more sympathetic dominant. What that does is it shuts down some of our gastrointestinal tract. The vagus nerve in the gut become affected, and it starts affecting the gut itself down here. And so this is why when we're a baby, you go and startle a baby, they jump, and because the parasympathetics have not been developed, that part of the brain has not been developed, and they have mostly sympathetic dominance. And that's why you can, a startle reflex in a little baby. That's why you can walk up behind an older person and they'll startle. It's because we go through a cycle where we have sympathetic dominance when we're a baby, and then we develop the parasympathetic side, and we're pretty well balanced. And as we get older, we lose it again, and we go right back. And babies have a tendency to be more constipated, when they're younger, because until they develop a normal parasympathetic side of their brain, and we have a tendency to get that in older age. And so it has to be kind of compensated. So we get the brain-gut axis is very much involved in the body, where we have the brain affecting the gut and the small intestine, and they're all causing a interconnection and a stimulation of gastral phases of local nervous systems, circulatory plexuses, vagus plexuses, gastrohistamine stimulation, and it's all working in conjunction with the brain. And therefore, the digestion and the nervous system and the brain are not separated in any way, shape, or form. And once we talked about the gut and autoimmunity affects brain function, affects poor vagal activity, which can manifest in decreased pancreatic enzyme secretion. So the brain itself. Now, what happens with this is we're going to see is the brain can be affected by numerous different types of factors, and those need to be addressed. Decrease in activation of vagal motor nuclei, which in turn suppresses intestinal immune system and decrease intestinal blood flow. The brain can affect the intestinal immune system, and your intestinal immune system affects about 80% of your immune system throughout your entire body. So the brain actually affects the intestine affects the immune system. Increased growth of pathogenic yeast and bacteria that cause intestinal permeability and leaky gut. That can happen with autoimmunity, and leaky gut causes a state of chronic low-grade inflammation. Then the inflammation cytokines produced in the gut travel through the bloodstream, and they cross the blood-brain barrier. And then it starts all over again. And so once the inflammation occurs in the brain affects the gut causes more leaky gut, the leaky gut goes into the bloodstream, it gets to the blood-brain barrier, it goes back into the brain, and it produces this chronic cycle that's affecting us health-wise, and it just keeps spiraling down. It's an epidemic. It causes a loss of self-tolerance. Your body can't tolerate itself anymore and starts producing antibodies against itself. 1 out of every 9 women and 1 out of every 12 men have been diagnosed with an autoimmune-related disease. I think this is a whole lot higher than that. I see it. This is so rampant. And this is just diagnosed disease. There's so many people with autoimmune problems going on in their body and they have no idea they got it because they're being treated by symptom relieving pharmacology on the outside. These symptoms are popping up all over the place, and they're just being patched chemically, and they're not being addressed at the underlying problem. 50 million cases of undiagnosed autoimmune disease, and that's what I believe the problem is right there. Compare this to 9 million cases of cancer and 22 million of heart disease. There's more cases than cancer and heart disease combined, and yet nobody even knows about this thing. We're all worried about the cancer, and we're always about the heart disease, which is important. But there's 50 million cases of undiagnosed autoimmune. And this stuff goes on for years and years before it's ever actually manifested in symptoms. And then, unfortunately, most of the time, then just patched chemically. Stages of autoimmunity. Silent autoimmunity, positive for antibodies, but no symptoms or loss of function. And then there's reactive autoimmunity, where it started to be progressive to the point where signs of tissue loss is evident. Not evident enough to be labeled autoimmune disease yet. This is just symptoms popping up in standardized medicine. And then we get to the autoimmune disease stage. Symptoms and loss of tissue is significant. That's when medicine jumps in. And that's, how they treat this then? They give you biologics, which are autoimmune suppressant drugs that decrease your body's ability to respond to its own self. The body's going after itself, so it decreases your body to respond. and basically decreases your immunity. Then that allows other bugs in your body, which we all have, to start increasing in numbers, and then you end up with other secondary increased fungal, bacterial, viral, in many cases, infections that pop up. And this is why they won't give you biological types of drugs if they know you've had fungal infections or been in other countries, because they're afraid that you, and tuberculosis is a big problem, and cancer, because it all, when you suppress your immune system, everything takes off. And it's not a good, what we want to be doing is getting to the underlying cause whenever we possibly can. And so gut-brain connection, Parkinson's disease have been found to be caused by degeneration of the gut before the brain. They connected the gut-related problems before it ever shows up in the brain. And so there is a strong correlation between gut-related problems preceding Parkinson's. And they have bunches of research on this. Chronic constipation occurs years before Parkinson's disease. Patients ever develop tumors, they have this occur. Poor gut health can cause depression. A large percentage of our normal neurotransmitters that are actually affect our overall brain health and our own mood are present and developed from our gut. Our gut actually affects our mood tremendously. And I've seen this happen so many times where we've changed gut health, got people's irritable bowel syndrome, the symptoms get better, but their overall outlook on life gets better. And many of these people are on antidepressants, and they get better because their neurotransmitters, their normal brain chemicals become balanced. They become balanced once again naturally because their body starts producing it. So we get bad gut, we get bad health. That's really the key. It's not just a gut problem, it's certainly painful. And I've experienced this myself, as I mentioned. I've experienced how this can affect your mental health and everything else. It's amazing. And thank goodness I learned this earlier and been able to do this on myself and thousands of people, and I'm really passionate about this because I know how much it can affect you, and I know what it's like to live with it, and it's not fun. And it's certainly a whole lot better to be able to handle this naturally and get to the underlying cause of the problem. So here we talked about emotions. We're just talking about PTSD and major depression disorders, and they've definitely connected this with the gut itself. Gut and happiness, we just mentioned. The gut peptides, which are chemicals are released from the lining of the gut, travel to the brain, cause certain neurotransmitters to increase, results in the feeling of joy, and these come from your gut. Okay. IBS is said the thought to be a result of disturbed neurofunction along the gut-brain axis. Once again, more research showing that this is a definite connection. Okay, and then other sources of gut-brain disease is chemical toxicity. I'll just touch on this briefly. We're almost done. Is that the chemical toxicity in our bodies from our environment affects certain parts of the brain across the blood-brain barrier, and this through the gut-brain axis can affect the LES. You don't know how many people that I've treated with reflux that their problem was the inability of their body to detox themselves, and they're holding certain amounts of chemical toxicity in their system, which is affecting the brain, which is affecting the LES, which is not closing the sphincter, which is causing the acid to secrete up in their esophagus. If you follow me, this is the problem, is we're not getting to the underlying cause. We're throwing more toxicity in, we're throwing more drugs in. And this is not getting to the problem. And then increased infections and resulting exotoxins, which occur with that too. Because you get a chronic infection in your body, and these are infections that don't make you deathly sick, but just sit in your body, just producing exotoxins. Those are toxins, and they can affect the gut-brain axis. So you got to eat what can you do to help yourself? Eat real food. Be sure you look at labels. Be sure things don't have toxicity in it. Learn what a label is. Be sure you don't, if you don't know what the heck the thing is, you've never heard of it, it sounds like a chemical, don't eat it. Decrease toxicity, increase organic vegetables, processed food. It's worth it. It costs some money, but a lot of those things that are in food make you more hungry. There's a lot of MSG, a lot of food additives that actually increase your hunger. You start eating organic food, a lot of times you just don't eat as much because you get filled up easier. You decrease carbohydrates, you eliminate processed oils. You try to stay to olive and and into good oils like palm oils and um, and unprocessed extra virgin olive oils, and you stay away from the canolas and the vegetables and the sunflowers and the stuff like that, and the things that are highly processed at high temperatures. They're really, really important. Use a progressive elimination diet. If you're not sure what you can eat, you eliminate one thing at a time. If you've got to eat one food in a day or two, and then eat one other food, and then keep a diary and write it down. Find out what you're allergic to. The 3 R's of reducing heartburn and GERD is reduce factors that promote bacterial overgrowth and low acid, replace stomach acid with enzymes and nutrients that aid digestion are necessary for health, and you restore normal beneficial bacteria and healthy mucus lining in the gut. So you reduce, you replace, and then you restore. You reduce the bacteria that's bad, you replace the stomach acid, and then you restore good bacteria. That's a really, really good process to do. Now, this sometimes you need a lot of help to do this because it's not quite as easy as it sounds, but that's really basically what we need to do. So we reduce carbohydrates. Be careful of too much fiber. Specific carbohydrate diet is really good. The SCD diet, the GAPS diet, something you can look up and do that. And then low food map diets. They even have apps with this that you can use. And the fructose artificial sweeteners are good things to avoid. You got to reduce those out because the fructose will definitely feed abnormal bacteria, and the artificial sweeteners affect even all those different factors we've talked about. Clinical nutrients, herbals, and homeopathic remedies are all beneficial and need to be used instead of the pharmacology whenever possible. Replace stomach acid, enzymes, nutrients that aid digestion and are necessary for health. HCl with pepsin and bitters. The old bitters people used to use in the South where they take it. There's a digestive enzyme that we use that has bitters on the outside, and you kind of suck on it a little bit, get the bitters, and then you swallow the digestive enzyme. It really does calm your stomach down and produces some stomach acid. And by doing that, it actually helps the GERD in a large percentage of the cases. Restore beneficial bacteria in the gut, probiotics, bone broth, and large chain fatty acids, which is really important to producing good gut biome. And then how is DNS and functional medicine approach different? So what do we do differently when we help? Okay, it works to restore body back to health, not just supply a chemical patch to cover up the symptoms. And the phytoclinical nutrients includes homeopathics, herbals, preparations found from all over the world. And then we have specific ways to find out exactly what you need. And that's really what's important. And instead of just taking nutrients, we have a way through really cutting edge biophoton technology as well as functional medicine blood testing and laboratory testing to figure out exactly what you need, what your body responds to. And just taking supplements helter-skelter doesn't get us what we want. And we got to search for the cause of the disease, not just merely treat the symptoms. We got to go deep. And this is a little diagram I produced that really shows how we go about this. This blue arrow in the back arrow, the circle, is really your symptoms. And the way we want to cover that is through functional lab testing, a comprehensive consultation. We go back all the way to birth, and we spend a tremendous amount of time with a 26-page, real comprehensive entrance form that gives us a bunch of information. And then we also do a neurokinesiological biofeedback exam, which uses biophoton research even by Nobel Prize winners in science to get information directly so deep that we're getting things that blood tests cannot even give us, and then we're combining it with functional blood testing to also give us this information. The functional blood testing, normal blood testing, you got big old wide normals, okay? And you have to be way out into here to be abnormal. In functional blood testing, we narrow these normals. We get much more narrowed in the normals into what we call functional lab ranges. And unfortunately, through the years, what's happening is these have gotten wider and wider and wider, these normals. And people are getting out in here. You can be all the way down in here, and they say you're normal, and you're not. You're feeling bad. Your lab tests say you're great, but you know you're not. And you say, and then they start telling you have emotional illness, and they give you antidepressants. Everything's antidepressant. If they can't figure out what's wrong with you, then it's all in your head. And we're finding that this is not the case. That a lot of times people are truly not feeling well, but they have been analyzed and been diagnosed on really the wrong functional levels, or these big gigantic ranges, rather than narrowing them down. Advanced lab tests for gut permeability. We got lactose, mannitol, permeability changes. We got intestinal barrier functional tests. We have all kinds of different tests also we can use for in lab testing. But we try to keep the lab testing down as small as possible, because some of these tests are not covered by insurance and they get expensive. And we want to give you tests that produce the most information at least amount of cost. We're not just in here to throw a bunch of expensive tests at you. We want to make this doable for people. If it's not doable, it's not going to help anybody. But here's some advanced gastrointestinal profiles that we can do that show parasites and yeast and fungus, and also give sensitivity on actually what helps it once we find it, which is pretty cool. And then advanced GI functional profiles, where we can actually measure what's in the gut and which bacteria is, how much is each one is, and there's an overgrowth or an undergrowth, and that helps us too. So a comprehensive functional medical evaluation we can do is a comprehensive timeline history, a functional physical exam, heart rate variability, body mass index, postural blood tests. We do just numerous different things: temperature of the extremities, oral zinc test, complete systems of biophoton, neurological biofeedback exam, functional blood testing, comprehensive report of findings, and recommendations for the care. And we sit down and we develop an individual program according to what you're finding. See, some people can have toxicity that's affecting their irritable bowel syndrome. Some can have a biome problem in the gut, and they have a overgrowth of fungus in their stomach. Others could, have all those different causes that we talked about. It's so individualized. There isn't one treatment that works for all, and that's the reason they fail at it. They find one symptom, they produce a drug for it, and then they give you an antispasmodic for your drug, for your bowel, and they try to just relax your bowel instead of trying to figure out what's irritating your bowel, and that's the problem. Well, if you'd like to make an appointment or talk more about your particular conditions, you can do it a couple different ways. First of all, you can call 850-933-5616 and talk to me personally. I can give you a little 15-minute no-charge consultation to see if this type of care is right for you. Also, you can go to www.drdavidharts.com, and on that website you can find a place to make an appointment as a new patient, and that way you can get a spot on my limited schedule, and we can do a complete and very thorough evaluation of your condition and find out exactly what is going on and get to the underlying causes of your problem, and stop treating these symptoms which are just not getting you where you need to go. So I'd be happy to talk to you. If you have any questions, just give me a call, and I can get a good idea, just even from that 15-minute conversation, whether or not this would be right for you. Look forward to seeing you.